Hello, good afternoon. Welcome everybody to this session. My name is Lauren Vilanovic. I'm a communications specialist at PAHO in Washington, DC. And we're so happy to have you here connected today. We know how incredibly busy everybody is. And so we really appreciate your time. Um, if you have questions throughout the session, please write them in the Q&A box that's at the bottom of your screen. If you're having technical or audio issues, you can put that in the chat box. This session will be recorded and we are going to share the recording, the links to the materials and the presentations afterwards. So if you know somebody who's unable to make this session now, they can catch the recording later. So without further ado, I'm going to pass the floor to Dr. Cuauhtemoc Ruiz Matus. Dr. Ruiz is the head of the immunizations program here at PAHO for the region of the Americas. Thanks very much.
Thank you, Lauren, and thank you, everybody, to be here in this session. And welcome to this session that we are going to present and to launch the guidelines for the vaccine safety communication, the guidelines for the care workers. And thank you for this. Like Lauren saying, I am Cuauhtemoc Ruiz Matus. I am the chief of the immunization program here in PAHO. And the first point is that we appreciate you are participating in this session. We know that in this moment of the pandemic, all of you are involved in a lot of activities and principally related with the pandemic, but independently of this, your work it's very important for the immunization program. We say all the time that the real areas of the immunization is the people in the countries, is the people in the field that with their work improve the coverage and to maintain this communication with the population. And welcome again to be here. This session is designed to help you in all the communication about the vaccination and the vaccines with the users of the vaccine and the community members. It's very important, you know, that the interpersonal communication is a key skill that is necessary that the healthcare workers maintain and to domain with this skill. Because with this, it's the real benefit in this communication that you have with the patient of the community of the family of the members of the people to receive your service in your health workers. It's in all the information that we have, in all the studies that we are looking that the most important focus in the population to receive information about the vaccines are the health workers. And this is the reason that we are looking with you that is necessary to have information to be a good vaccination advocacy, answering the questions and dispelling the rumors and myths that we have now. You are looking that with this pandemic, at the same time that of this pandemic, we have a really important increase in the information that we have in all the media, not only in TV. It's in the all the media that it's possible. But this ground of information is not necessary that the quality of the information. A lot of this information is lack of evidence. They don't have the evidence to be true, and it's a confusion for the population in this. This is the reason that we are looking at the responsibility that you have, the responsibility that we have to give a real information, the evidence, the true information, the information that is based in evidence is very important. And your role is important here. Because all the question about the vaccine against COVID-19 is going to impact what is happening with the regular program. And unfortunately, if we don't have the capacity to stop the rumors and to increase the consideration of use of this vaccine, that the population understand the benefit of the vaccination, this is going to impact the regular program. And we hope that we will not have in the future cases of measles, pertussis, polio, or other vaccine preventable disease in our regions where you are working very hard to stop, to eliminate, and to control this. So thanks again to be here. I hope this session and the materials that we are sharing with you are helpful to you and your quest to be the best immunization areas you can to be. You can be. Thank you again to be here. Thank you to the PAHO and you could be sure that all the questions that you have, all the information that you need, you can to came with us to PAHO, and we are going to support all the necessity that you have to do this and to have a very successful work in your community and in your health center. Please, I'm going to move now and to give the floor to Maria Paz Bertoglia. Doctora Maria Paz, please take the floor.
Thank you, Dr. Reese. Very happy to be here with you. And I'm going to share with you if there. Well, this is going to be a short presentation of the first part of the manual that we're going to be sharing with you. I'm going to be talking about the communicating about vaccine safety and the factors that influence the decision to vaccinate, and some guidelines on interpersonal communication strategies. We're hoping to make a very dynamic presentation. So then we're going to be sharing with you a case-based exercise. So this is the presentation of the table of contents on the manual. As you can see, there are several aspects that you're going to be able to review them in the manual, but I'm going to be making a presentation about the factors that influence the decision to vaccinate, so we can understand them and we can guide or tailor our message basing on that. Also, we're going to sharing some communication strategies for the interaction with parents, caregivers, and patients. And then we're going to talk about some strategies to improve the vaccination experience. There are several chapters in this manual that, because of the time strain, the time of this webinar, we're not going to be able to see them, but we are inviting you to review them. There are a couple of chapters on frequently asked questions about vaccination, and frequently asked question about several vaccines that are very important in the communication with the general audience. These are the vaccination on influenza, on human papillomavirus, measles, and also vaccines frequently asked questions about the vaccination on COVID-19. And then my partner, Catarina Sofia Dolezal, is going to be talking to you about the second part of this manual. So these are the presentation objectives today of my presentation. We're going to be talking about getting to know the factors that influence the decision to vaccinate, also getting to know the spectrum of the acceptance of the vaccination or the hesitancy. And we're going to be sharing some communication strategies that we hope they're going to be very helpful for you. And then some strategies to improve the vaccination experience. We know vaccination can be very frightening for some people, and we know it produces pain. So there are several techniques that we want to share with you to make this experience or to improve the vaccination experience. And lastly, we want to share with you some practical tips to the communication to the patients and the caregivers. So first, we're going to be talking about getting to know the factors that influence the decision to vaccinate. We would like that people will make this decision so only basing on scientific data and on evidence, but we know this is not how we are built. We make decisions based on a number of factors, and one of them is the biases or the heuristics, the affective biases, and that can be very important when we make a decision. So in this slide, we want to share with you some of the factors that influence this affective bias when we make a decision. These are the factors that can really affect how we behave. So in the left part of this slide, you can see that if a person has a higher level of the risk related with the illness that the vaccine is going to prevent, then that person is going to have a much higher chance to receive the vaccine, or if there is a parent, to their child be receiving the vaccine. And on the other hand, if that person has a higher level of risk or risk perception related with the vaccine or the side effects, there's a higher chance that that person is not going to receive the vaccine, or their children. So this is the affective bias. This means that we tend to be guided by our emotions. Thus, those emotions alert us to potential risks and predispose us to act. And this is not merely based on what we read or what people tell us, but also what we see. So we can see that if we are going to be providing some message to the people, to the general audience, and we're going to be using some photographies for a vaccination, we will be recommending that we use photographies that show this act, but show them in a manner that is not frightening, like the photography that you can see above. So if you can, the recommendation is that we use some photographies that show this vaccination act, or in a manner that doesn't transmit fear or pain. There are several other determinant factors in this decision to vaccinate. There's the loss aversion bias. This means that we tend to focus more on the losses than on the gains of our actions. So we have to bear that in mind when we transmit with people. Also, there's the confirmation bias. We are very vulnerable to this bias. This means that we are more likely to trust the messages that supports our previous conclusions. We are not very good to changing our minds, so we tend to choose the information that confirms what we believed previously. There's also the availability bias. This means that we make decisions based on facts that come to mind immediately, and we tend to forget the facts that are very distant to us. Then there's the anchoring bias, and this bias means that we tend to base our decisions on opinions that are very familiar to us. So the context is very important for the decision-making process. Also, in this decision, there's another factors that are very important, that is the risk perception. And there is a gap between how us, the health staff or the health workers, perceive the risk related with illness and with the vaccination process. And there is other factors that influence how the public or the general audience perceive the risk, or the risk perception. And we, the public health authorities or the staff, tend to construct or build this risk perception based on the information, on scientific data, on evidence, or the trainings that we make or we receive, and also the research on the evaluation of causality. But the general audience or the public builds the risk perception from the information that they gather from several sources. And these sources not only are the evidence-based data, but could be evidence or information that is not scientific. Also, the general public perceive this risk based on their emotions, based on their previous experience. So if someone has a very bad experience related with a vaccination, that's going to affect their future behavior. And also, as I said recently, there's the biases or the heuristic, the affectivity or the emotionality on the communication that can affect how we perceive this risk. So we have talked also about the vaccine hesitancy spectrum. This means that we know that people, it's not a yes or no decision if we want to receive a vaccine. People tend to transit in this spectrum depending on the context. And this means that in this arrow, we can find people in different places or in their different periods in life. So there's this green area of the arrow where we can find people that accept the vaccination, and we can find people that actively accept vaccination, that seeks to be vaccinated. And in the middle, we can find people that passively accept vaccination, so we have to go find them. And then on the orange side of this arrow, we can find the vaccine hesitancy, meaning that people, some of these persons are not going to accept some of the vaccination or are going to delay some of them. And in the last part of this arrow, we can find some very small group of people, but are very vocal. And there are people that rejects all of the vaccines. And as I said, this is not a static diagram. People can transit along these spaces in the spectrum. So we have to tailor the activities or the communication activities regarding on where they are found in this spectrum. And this you can find in the manual. There are some components of the vaccine hesitancy model that we want to share with you. I'm not going to talk about this whole diagram because we don't have much time, but we invited you to review them in the manual. But there are three aspects in the vaccine hesitancy model that we want to share with you. And we have to bear in mind when we design communication activities with patients. The first one, and one of the most important ones, is the confidence. We need to establish the confidence with the general public regarding in relationship with the safety and the effectiveness of the vaccines. Also in the immunization program, people are very, very important how they perceive the public health authorities and the general immunization program. And also the motivation that the authorities that decide which vaccine and which people are going to receive them. The other factors that are very important in the vaccine hesitancy model is the convenience. And this means that is based on the availability of the vaccine. In that can be a physical availability, but also geographic availability and the ability of the general audience to understand the messages that are being communicated to them related with the vaccination. And the third factor is the complacency. And complacency, we can find them when people believe that the risk related with the vaccine preventable diseases are very low. So they think that there is no need to take preventive actions like receiving vaccination. So we can see these three factors coexist and can influence where a person can be found in this hesitancy model. So what other factors and determinants about the vaccine hesitancy we can find? There are three major factors that we're going to share with you. One of them are the contextual factors. This means that in the context where we live, there's a very important variables that we have to identify, and we can see if those actors can be very important where we design these messages. For example, the media is very important to people and how they perceive the vaccination or the risk related with the diseases or the vaccines. Second, the leaders and the activists that we can find in that community can influence also the general audience. The historical trends are important, and of course, the religious and political factors of that community can influence the vaccine, how the general audience perceive the vaccinations. Also, the other barriers that we were talking about, like geographical barriers, the perception of the pharmaceutical industry, all of those contextual factors can be very important on the hesitancy spectrum. Second, we can find the individual or the group factors, and this is very important in relation with the context very near us, meaning personal and family and community experience can also influence how we perceive the vaccination. But also the health system where we provide or how much trust there is in these care providers. And also we tend to do this risk benefit assessment, and this can influence also the social norms in the context that we are living in. And thirdly, there's some specific factors related with the vaccine or the vaccination. And here we can find that we are also doing constantly this risk-benefit analysis. And there are some particularities, for example, when there's a new vaccination or a new vaccine, like in the COVID-19 context, it's very important for the population. Or, for example, if the vaccine is part of the routine program, or if it's part of a campaign. Also, the reliability on the vaccine is very important. And some other factors that are very context dependent, like if there's a cost involved, or if the degree of the strength of the recommendation by the authorities. All of this can influence how the general audience perceives the vaccination and the safety of them. So we want to share with you some of the communication and interaction strategies that we are hoping that can be very useful to you. These are some of the communication recommendations, basic communication recommendations. The first one that we want to share with you is when you are in contact with a patient or with a person that's going to be receiving a vaccination, there are two approaches that you can use. The first one is called the presumptive approach. In this approach, the idea is that you are presume that the parents or the patient is going to be receiving the vaccination. So you can ask that person, or you can tell that person, today we are going to give your child the pentavalent vaccine, for example, to protect them against 5 serious diseases. Or your child needs a shot today. At the end of our appointment, I will give you a vaccination schedule. So you presume that the person is going to be receiving the vaccination. That is the presumptive approach. So we can start with that. And if the parents accept and have no additional questions, then you proceed with the vaccination. But what happens if the parents are not ready to vaccinate? Then there's another approach that we can use that is called the participatory approach. And here are a couple of examples of the questions that you can use, like, have you thought about what vaccines your baby needs to be protected from in your illness? Or what do you think about vaccines? Is it all right with you if we vaccinate your child today? So you see, there's a different approach depending on how that person is perceived related with the vaccination. So if that person accepts that vaccination, you can proceed with that. But as we can see it in this diagram, there are going to be some group of people that, despite everything that we try and do, is going to have more questions or concerns. And if this is the case, we have to always remember that trust is very important. And one of the core principles of trust, as we're going to be seeing next, is the bidirectional dialogue. So we have to try to use that. And here are the core principles for building trust. The first one is the competence. This means that we have to show the patient that we have the necessary competencies in the field of immunization and in the interpersonal skills to answer their questions. The second one is the objectivity. This means that we have to be very clear about and transparent that there is no conflict of interest with regard to the pharmaceutical industry, for example. The third one that is very related with that is the transparency. And this is essential to the communication with patients, that we have to be very transparent and honest about what we know and also what we don't know about what they are asking. Then the inclusiveness. This means that we have to acknowledge the relevance of all points of view. And this is not depending if they are based or not based on evidence. Then we have to be very consistent. This means that we have to be consistent in the messages related to vaccination and with every patient during every visit. And lastly, as we were saying before, this is not merely based on data and on evidence. Also, this communication is based on empathy and on engaged in a two-way dialogue. So these are a couple of tips that can be very useful when we talk with patients or parents of child that are worried about the vaccination. We have to communicate about the benefits that are individual, but also about the collective benefits. So depending on which person we are talking about, if there's a parent of a very small children, probably they're going to be very worried about the health of their child. So maybe we can focus more on the individual gains of the vaccination and the protectiveness of their children. But also we cannot not talk about the collective benefits. And probably in more older person, it's going to be very important that we tell them that the vaccination is not only an individual decision, but also can affect the community, and we can protect the community if we take that vaccination. So we have to use those both approaches. And if we talk about vaccination and communication, we cannot not talk about social media, because we know that there is a lot of people that gather information and make decisions based on what they read on social media. So if you as professionals of healthcare have a social media account, probably you have encountered people that ask you some questions about vaccination or vaccine safety. So there are some recommendations that we can give you about this dialogue so that we don't get frustrated, because it is very time consuming. So first recommendation is that we address the fears and doubts of the general audience through the dialogue and the evidence. We have to base every comment on the evidence. But we cannot forget about the emotional aspects of communication. This means the cognitive biases that we were talking about just yet. And this is a recommendation that if we can share some personal stories, like when I went and received my vaccination, or when I take one of my colleague, my familiar, my child, or I accompany a familiar to take the vaccination. That can be very useful. Then if you have a professional account, if you are part of a health organization and you can use that general professional account to communicate, that is very useful. So people don't see it's just one person, but there's an institution that's behind that message. And also there's a recommendation that we can combine the messages of the evidence-based about vaccination and vaccine safety with some entertaining messages, with sharing a video, sharing an infography that can be very useful when we are talking to the people. You're going to find negative comments. That's a fact in social media. So we don't have to be frustrated about it. We have to try to engage, not engage directly with them, but we have to bear in mind that in the dialogue, there are going to be some other people seeing that dialogue. So we have to bear that in mind. And lastly, it's very important to take into account the ethics and the data confidentiality of the patients that cannot be shared in social media. So I'm just going to talk about two general social media that is very used in our region, Facebook and Twitter. In the manual, you're going to find other examples of social media and recommendations. But generally in Facebook, we can find mostly parents that are worried about vaccination or vaccine safety. So we have to be there. We have to make some dialogue and take that into account, that in Facebook is a very important source of information for people and parents also. Twitter is real-time social media that changes very frequently. So if we're going to be posting on Twitter, we have to know that we cannot post just one time a week, because it's going to be very dynamic. Journalists, if we want to find them, they're going to be mainly on Twitter. So if there's a news that we want to share with the media, that's the social media that we can go. And lastly, this is not a social media, but it's a repository of validated sites from the World Health Organization. This is the Vaccine Safety Net. We invite you to review that. And it's a very useful site that you can find different sites that are already validated, so you know they are trustworthy. So I'm going to be advancing. Lastly, this is going to be, we're going to share some of the strategies to improve the vaccination experience. As I was saying at the beginning, we know vaccination is very scary for some people. It produces pain. So we have to do everything that's in our power to make that experience more bearable. So there are some pain mitigation and anxiety mitigation strategies that we want to share with you. If there is for smaller children, we know that the breastfeeding them before, during, and after is a very strong favorable recommendation. We have very solid evidence that can be using this recommendation for you. So this is very strong favorable recommendation that we want to that you know of that. Then if there's not a chance for the mothers to be breastfeeding or using giving them the bottle, we can there is a limited favorable recommendation of using sugar solutions if that is the case, and you can do that also for a pain and anxiety mitigation strategy. And then there's a very easy task that we can share with the parents. For example, they can hold their children. So children should be held or accompanied by their parents or their caregivers. If the children is older, it could be seated, except if there is a history of fainting. That's important. And lastly, there are some techniques that can be very useful, like distraction techniques with children, that we can use toys or videos or music so they can have an experience that is more bearable for them. And for adults, the only strategy that we know that had some some evidence that can be used for the recommendation is some breathing techniques, but we have to be very careful that this breathing technique does not mobilize the arm where they're going to be receiving the vaccine. And lastly, there are some strategies that are not recommended, that does not have solid evidence, like the use of topical anesthetics or warming up the vaccine previous to the application, or the use of oral analgesic prior to the administration of the vaccination. So this was not recommended. So we would like you to be in acknowledgement of that. So with this, I'm going to be finishing my presentation so we can go with a very small workshop that we want to share with you. But this is a question that we want to be ending this presentation. That is, what is the main objective on communicating about vaccine safety? And the main communication objective is to build, to keep, or to rebuild the trust on the importance of vaccines and the benefits of the vaccination and the immunization. So with that, I will be finishing my presentation. I'm going to be asking to Katarina if there are some questions that we can answer. I'm not seeing one. So Katarina.
Thank you so much, Maria Paz. And just to reiterate what a pleasure it is to be able to be here with you today and to present some of the guidelines that we very much encourage you to also go through in detail after our presentation. Maria Paz, I cannot see any questions in the Q&A box for the time being, but just maybe to say that if you have any questions, please do put them in the Q&A, and we'll do our very best to try to respond to these after our presentations. I think we can move to the first exercise, because we really wanted to render this webinar also interactive and have some tasks for you. Do you want to add anything, or should I go ahead?
No, I think we can go ahead so we can begin our first case study.
Brilliant. So Maria Paz is going to help me and actually do this with me, because we came up with a hypothetical conversation between a vaccinator and an elderly patient that's slightly hesitant to actually receive the COVID-19 vaccine. And we're going to start by just reading out sort of the beginning of this conversation, and are then going to ask you through a Zoom poll also some specific questions. So let's go to the next slide, please. Maria Paz, do you maybe want to start reading? Then I can read the elderly.
Yes, of course. Sorry.
Vaccinated. Thank you, Maria Paz.
Great. So good morning. I hope you're doing well. Today we are going to vaccinate you against COVID-19, as you belong to one of the high-risk groups.
Good morning. To be honest, I'm in doubt and have some questions regarding the COVID-19 vaccine. I would prefer not to be vaccinated. The vaccine is too new. I would rather wait.
Tell me more about your doubts and the questions you have. I will do my best to answer them.
Thank you. I'm part of this WhatsApp group of retirees of the company I used to work for. It's a group of former colleagues. We share all kinds of information, including tips on leading a healthy lifestyle. I find this group very trustworthy. The information always seems up to date. We receive more trustworthy information there than can actually be read on the news. News channels don't always publish the truth. Recently, a colleague shared an article which stated that the new COVID-19 vaccines were not adequately tested, are not very effective, and were developed too quickly when compared to other vaccines. So this is a typical example of what such a conversation could look like and what sort of, preoccupations and doubts and anxiety could appear when, getting ready to vaccinate someone who's part of the priority groups. And now let's finish this exercise together and look at how we could best address our patients' questions. Fernando, if you could launch the first poll, please. So there's two different questions that we'd like to ask you. And the first one is, what would you say to your patient whom you wish to vaccinate against COVID-19? It says 29, sorry, that's 19. So first of all, it's truly stupid not to get vaccinated. Can you not see what's happening in hospitals around the world? Or, I can understand your doubts. However, it's important to highlight that COVID-19 vaccines were developed at such speed because of several reasons. Firstly, previous studies and knowledge, processes were adapted and clinical studies were conducted simultaneously. An important percentage of high-risk population groups have already been vaccinated worldwide. I myself am one of them. You simply have to deal with these risks. This is how it is. We all have to get vaccinated. Or lastly, and there's a few options we have here, and more than one can also be ticked. Vaccination constitutes one of the most important tools we have in fighting and ending the pandemic. We have to work together. And then for the second question, if the patient continues to be hesitant, what would you do? Tell her that she'll be excluded from social activities and will not receive any benefits. Share tailored information packages, for example, flyers and brochures, trustworthy sources of information, such as from the government and other institutions. Highlight the risks related to contracting COVID-19 and the benefits of the vaccine in preventing severe infection and potentially death. Take more time to address some of the questions in more detail and communicate as much of the facts as possible. And lastly, share that community leaders and representatives from local institutions have already received the vaccine. Maybe we'll give you one more minute. Fernando, what are we at currently in terms of the response rates?
30%.
Okay, let's give it a thank you. One more moment. Maybe in the interest of time, we can finish the poll and look at the results together. Okay, so I'm very glad to see that no one chose the first option of the first little exercise, and that most people would actually, acknowledge the doubts and the potential fears and just open questions. Regarding the third option, it is usually a very good strategy to highlight that, the vaccines has already been administered to so and so many people. Here, obviously, it says worldwide. The let's say, best strategy would very often be to highlight people in a community or in the same country that have been vaccinated, because people usually find it a bit easier to relate to someone closer to them as opposed to in a different country or even worldwide. And then obviously the last one, I think is quite obvious. Very nice to see that, oh, it's gone. Thank you. And then regarding the second question, it's good that no one chose the first one either. And yeah, I mean, there's obviously many different things that, you know, can be done. One of the things that we didn't mention here is that what could also be done is to kind of already make a follow-up appointment with that person and to say that, you know, we'll give you some information, take your time to read through the brochures to maybe see if they can answer some more of the questions you may have, but try to already nudge them to actually come back to the facility and get that shot, because very often when we just send them away with information without trying to directly follow up through a follow-up appointment, they don't always automatically, let's say, come back and then give it another shot at the second appointment. I would say without further ado, let's go to the second part of the webinar, which also corresponds to the second half of the manual. And we'll look at how to debunk misinformation and myths. We'll look a bit at how to communicate about AFIs or ESAVIs, events supposedly attributable to vaccination or immunization, or adverse events following immunization. And then in the last step, we'll also look into how to communicate with colleagues that may be a bit reticent or hesitant. And this really, the two presentations that we're giving, as Maria Paz has said, that they are very much correspond to the structure of the manual, but obviously we don't have so much time today, so we very much would encourage you to take another look at it. And if you have any questions, please do come back with those questions as well. Next slide. It's just an overview of the three big things that we'll quickly be looking at, and unfortunately we don't have enough time, but let's try to start maybe with debunking misinformation and myths about vaccines, which I think is a pretty pressing issue given that we're, you know, surrounded by information so much. And please go to the next slide. Thank you. We're very much surrounded obviously by a lot of different information of different kinds, and not all of the information that we encounter is always trustworthy. It may be misinformation, even, you know, disinformation, and the so-called infodemic. That term has very much been coined during, you know, the COVID-19 pandemic now. Please go to the next slide. And that's why it's very much important of, you know, how information is presented. And it's unfortunately not a very easy task to try to correct information and debunk myths, but there are a few strategies that we'll talk about now of how this can be done in a more efficient way. So we look a bit at how false information actually gets into our minds and why it's also thus so hard to delete it from our minds once it's in there. We're going to look a bit at how to different sort of reasons why it is that it's so difficult to remove false information. We're going to look at some basic strategies also for replacing information that's misinformation or myths. And then lastly, we're also going to look at a more practical example. Next slide, please. So specifically, you know, having the internet, having social media, having a lot of online platforms, information really circulates more rapidly than ever before, which means, as I said, not only trustworthy information, but also misinformation, disinformation. And this is why it's really everything is about how we communicate this information, but also how we present it. So our visual senses do play a very big role in this. And we've also seen in Maria Paz's presentation that when we communicate about vaccination and sort of, you know, put out messages that are accompanied by certain images, it's always very good to have rather positive images, not images, you know, illustrating pain and anxiety, but really images, you know, that transfer and really convey positive vibes and positive messages. Next slide, please. So why is it not enough to simply say that this is wrong, or this is wrong information, this is false information? And that's because of a few reasons. One of them being that we're not rational, we're very much driven by emotions and not always the facts, even though if we hear the facts, but we don't always really, they're not always anchored in our brains the way we do as communicators. And then also, like Maria Paz said, there's, you know, as we're surrounded with so much information all the time, and also are confronted with a lot of uncertainty, our brain has developed over the years a mechanism which is called also heuristics or cognitive biases, so that we can really, you know, sort of selectively remember this information and deal with this information, because the flow is just so impressive and so immense. And these cognitive biases obviously play an important role, not only in the perception of risk, but also how we remember certain information. So for example, to your left, you can see an illustration that when we say, you know, vaccines do not cause autism, the brain very often automatically deletes words that say do not cause and only remember vaccines and autism. And that's why when we're confronted with myths, simply repeating them or saying that they're not true could make it sometimes even worse. And we need a few additional strategies to be able to really effectively address these issues and replace this misinformation with the facts. Next slide, please. And it's also not so easy, and this is another factor that's important to consider, because what our mind does, so when we hear certain information or a myth, we create this kind of, you know, cognitive bubble in our brain with that myth. And if we try to debunk it, or if we try to say that it's not true, there's a void that's created in our brain that needs to be filled with some other information. And this is where we actually want to come in also as communicators and really try to replace this myth with the truth, or with, you know, evidence and the facts that we have. Next slide, please. So there's 3 sort of basic rules on how to correct information based on that we now know it's not so easy to simply say this is not true. And we also know from a lot of scientific studies that the more we repeat myths and the less we actually apply all of these rules of how to correct misinformation, the more the myths also circulate and the more the myths are also remembered by people. So I think this is a really important actually component of communication in general, specifically in a pandemic like the one that we're facing at the moment. So the first rule would be to actually really focus on the evidence that's out there and do not repeat the false information. Sometimes we obviously, in order to debunk, we do have to mention the myth or the misinformation, but it's important that it's embedded in a flow of evidence. And then, you know, it becomes sort of a bit of a smaller part of what we're actually trying to say if it's sort of in the middle and really embedded in evidence and the facts that we want to convey. In addition to this, it's also important to issue a warning before mentioning or repeating a myth or misinformation, saying that, you know, what we're about to say has been falsified, has been potentially retracted from online sources, libraries, etc., and to really make it very clear from the outset that what we're going to say is false information. And lastly, what we want to do is replace that myth with concrete evidence. Not for all cases do we always exactly know what causes X or Z, right? But in I think these cases, there are a lot of things we can say, sort of, evidence of facts around this. So for example, in the case of the false association between vaccines and autism, what we actually can say, there's a few studies that may hint at what may cause autism, but in addition to this, we can also say that, there was a very bad intention behind actually writing this paper. There was a lot of, financial interest involved. The medical license of that doctor has actually been withdrawn. The article has been withdrawn, and there's a lot of studies that actually prove that this was wrong. So there are alternatives that we can actually use when this is the case. Next step, please. Next slide. Yeah, and so when it comes to correcting misinformation and myths and debunking them, they're the very much sort of recommended strategies, a bit of a combination of what I just said. So it's on the one hand, trying to provide an alternative explanation as well as we can, and also issuing a warning before we actually mention that myth. And what I said before about sort of trying to embed a myth or misinformation and in a bed of evidence, let's say, we can see illustrated to the left, so that when you start with the myth and only maybe mention a bit of evidence afterwards, our brain will automatically remember the myth itself and not so much the evidence. While if you talk about facts and evidence, and then somehow embed the myth and the mention of the myth in between, then the strategy is a lot more efficient. Next slide, please. And let's also maybe look at a more practical example, which I already mentioned before. So again, the focus should be on the evidence. So we're going to resolve this doubt by reviewing the evidence, confirming the safety of the measles vaccine. So this practical example refers to the measles vaccine and the false association with autism. So we don't even start with, autism, we start with the vaccine, and that it's, that we're going to look at the safety profile of it and what we know and the very strong evidence in favor of it. Then we warn that what is going to come next is false information. And we can, for example, say many studies have been conducted that rule out this myth or false information, and they've confirmed that the alleged association is false. The measles vaccine is the best way to protect your child from a life-threatening disease. And it has been shown that that it does not cause autism. So here again, we really reinforce the safe nature of this vaccine, and also add a bit of risk-benefit analysis and say, that it is the best thing we do have to protect your child against the potentially life-threatening diseases with many complications. And this also comes next, where we replace the misinformation with accurate information, where we can say, for example, the measles vaccine protects your child from serious complications. Then we mention a few complications and even death. And then we say that in addition to protecting your child, this vaccine protects those who cannot be vaccinated, such as children who have received transplants and very young babies. So here again, going a bit beyond the individual benefits of this vaccine and saying that it's actually also a social responsibility to also protect those who cannot protect themselves and cannot be vaccinated. Next slide, please. Let's quickly look at the communication in a case of events supposedly attributable to vaccination, which is not easy, but very important, and a very important element of the whole, safety monitoring systems that are in place. Next slide, please. And really an element that should be part of every single step and phase of, from the first moment of detecting a signal all the way to potentially, concluding an investigation. So when you have this circle of investigation, reporting and monitoring and safety monitoring in general, communication should really be a crucial part of all of these different steps. We're quickly going to look at now the actual definition of an ESAVI, and then we're going to look at some of the communication strategies that are recommended. It's an adverse event supposedly attributable to vaccination or immunization is defined as any medical occurrence, whether a sign, abnormal laboratory finding, symptom or disease, unfavorable and unintended, that occurs after vaccination and does not necessarily have a causal relationship to the vaccination or the vaccine. And I think this last bit is, from a communications perspective, very, very important, that it's not necessarily in a causal relationship with the vaccine, but we have to bear in mind that when something happens, people are preoccupied, people do have questions, people may be anxious. And so that's why communication plays a crucial role in this context. Next slide, please. So the most important, really, let's say, parts of communicating about ESAVIs is on the one hand regular communication and timely communication. So we need to know exactly, when to start communicating, which is not always very obvious. I think it's important to look at who's affected, who are the groups that are immediately affected, and then who are the groups or audiences that may sort of be influenced by the decision making and also the way of thinking of that group that's immediately affected, because what we do not want is obviously spread anxiety or spread rumors or spread or further preoccupations. So it's really important to have a very tailored approach to communicating about this and communicating in a very timely manner with empathy, and going back to the key trust building mechanisms and elements that we saw in Maria Paz's presentation, such as transparency, professionalism, empathy, very important specifically with ESAVIs, when it comes to, acknowledging simply the population's uncertainties. I think this is a really, really crucial element in all of communication, that we try to establish a sort of, bi-directional communication channel and dialogue with the population, that it's us who really base our communication on what we know, the perceptions, the attitudes, and the sort of practices actually are in the population. Because if we do this also through social listening and monitoring of the public opinion, our communication strategies and materials that we produce and messages we disseminate will be a lot more well received, and will also be a lot more efficient when it comes to disseminating or conveying a certain key message. It's also important because if we acknowledge fears and anxiety and simply concerns, the population gets the feeling that, health authorities and the whole immunization program actually acknowledges this, and we know that trust is really, really crucial when it comes to communication, and when it comes to also maintaining this trust in vaccines, vaccination, but also those administering the vaccine, also in the longer run when something like that happens, so that we don't have to face a crisis at one point. And it also helps the population to understand that authorities and health personnel are actually doing their utmost to update them, and that they're concerned themselves and are actually reacting and are developing certain mitigation strategies in all of this. And as I mentioned before, in this sort of cycle, it's also very important to not jump to any conclusions. It's okay to say we don't know anything, but then it's important to say there is an expert committee that is actually conducting an investigation, that's actually working on this to the best of what they can do. But it's important for us not wait for them to communicate the final results, because many days could have already passed and trust could already be, an issue in the community or the city or part of a country where this may have happened. So it's very important that timely communication is actually made a principle from the very first start, and that regular updates are also being conveyed to all different actors. And that also brings me to the next point, that it's important to really speak with one voice and make sure that the expert committee that's investigating, for example, the case, that the health personnel that may have been involved, and also the health authorities, that the messages are the same, that there's consistent messaging, that there's no mixed messaging. We know from experience that speaking with one voice and really showing that there's a good collaboration between actors and stakeholders is really one of the most crucial element of crisis communication, and that trust can be very well maintained if this mechanism works well, and if all messages that are disseminated actually are the same, consistent, and sort of that everybody speaks with the same voice. We can go to the next slide, because this then also shows, you know, if you talk a lot about experts that are on that case, that you have a strong system in place that does actually do signal detection, and that's actually concerned with, you know, what's happening, and that can also convey a lot of trust in the population. Let's now, in a last bit before going to one more exercise, and then also handing the floor to Dr. Pastor, who will actually talk a bit more about ESAVIs as well. How can we communicate with vaccine hesitant colleagues? Next slide, please. Let's just look at some of the communication strategies as one main objective. So let's try to address this. Next slide, please. Just as a quick reminder that we also saw in Maria Paz's presentation, I just want to show these two graphs again, because I think it's important that when we speak about hesitancy, when we try to develop strategies to actually address some, you know, hesitancies or hesitant questions or fears and concerns, it's important to know that we're really speaking about this larger spectrum of hesitancy, that it's not, as Maria Paz said, a yes or no decision. There is actually a lot of room to play with. And that also here, the most efficient communication strategy is always to target sort of the middle of the arrow toward the left. So people where you know that may have just concerns that can be addressed, whereas, you know, behavior change can actually be implemented or rather achieved. And then also regarding the gap of risk perception, this again is something that is usually applied or applies more for, you know, the general population, and then the healthcare workers that just have a more profound understanding of risk and also of just the science behind vaccination in general. But this gap actually may also affect healthcare workers. Next slide, please. So what do we do when the gap actually affects healthcare workers? And I'm just quickly going to discuss a few different strategies here. One of them is empower people in their decision making. And this can be done again through this bi-directional dialogue. Make them heard, make sure that their concerns are actually acknowledged, and then base your answers always underlying sort of, you know, how can I say, like incorporating facts with this, but try to really convey to them that, you know, what you wish to say is based on actually their concerns and their questions they may have. Talk about the collective benefits, not only the individual benefits. Here we know that with people that are very reticent, highlighting individual benefits before collective benefits is actually better, but it for sure is a very important strategy to still talk about social responsibility and protecting others also through vaccination. Highlight the risks associated with vaccine rejection, or rather, you know, highlight the benefits of vaccination versus sort of the risks of not vaccinating. So this is the classical risk-benefit conversation that should be conducted. And they're really, you know, highlighting the big risks that are associated with them not vaccinating and potentially contracting a disease. Talk about evidence, the facts that are out there, and really try to embed this conversation in the evidence that we have, the scientific rigor that's behind trying to, you know, develop vaccines, how they're developed and how they protect against potentially life-threatening diseases. And use also assessment tools. What could be done also is establish some kind of rumor mechanism also within, hospitals or within primary healthcare centers, etc., where rumors can be detected before they spread. So that's also a very good mechanism to try to actually maintain trust and try to really address some of the questions that may arise before they could potentially erode trust in vaccines and the authorities or the people delivering them. And similarly to the photos that we saw, just spread positive messages and create messages that are tailored, targeting health workers. And then lastly, let's very quickly, given that we're all have either or are working on introducing COVID-19 vaccines, just very quickly look at this example. And here, what I want to highlight is really, again, adhere to the trust building principles of transparency, sincerity, clarity, competence, etc., and try to develop a tailored communication plan. I think with COVID-19, what's very important, and that's similar to influenza vaccines and influenza vaccine campaigns, is that we're facing this time, different segments among healthcare workers themselves, because they'll be both receiving the vaccine and they'll also be administering the vaccine, and there may be different questions involved in the different two groups. So that's very important when communicating, I think, about COVID-19 vaccines, to kind of keep that in mind again, and the importance of having tailored messages in place. And again, when we talk about, vaccine hesitancy, really try to target those that have concerns and questions and that may be actually convinced to move toward the left, the accepting part of that vaccine hesitancy spectrum that we've already seen various times in today's presentation. Next slide, and I think that's all from my side. Just to say once again, thank you very much for your attention. We'd love to answer some questions. I'm not sure if there's some questions, Maria Paz, in the chat that came in.
Yes, there's a couple of questions. One is very related with the workshop that we're going to be doing now, and it's from Daniel Epstein. He says that in Barbados, for example, it was reported that 30% of health workers were reluctant to get the COVID-19 vaccine. Some wanted to wait until later. Is this risk perception on their part addressable, and how?
Well, Maria Paz, maybe I can quickly start and then I'll hand over the floor to you. I mean, I think here again, the classic, risk-benefit communication can work its magic. I mean, healthcare workers are in the priority groups because of the reasons that we're very much aware of. They are at one of the highest risks. They're in the front line serving many patients with COVID-19. So they're obviously at the highest risk also of contracting the disease and potentially actually having, severe COVID infection or dying of it. So I think the risk, using the risk perception element that we've seen, trying to look at a very strong risk benefit analysis would be my answer to this question.
Yes, totally agreeing with you. And we're going to be making a very small case-based scenario that is going to be based on these elements of hesitancy among health workers, among colleagues. So maybe we can go with that exercise after. But there's another question that is very, very interesting from Lisa Bailey. She says, are ESAVI something that you should share before something happens, or mention it before to make people aware that it can happen? My question is on timing. So Lisa is asking if we should talk about ESAVIs before the vaccinations.
I think, and Maria Paz, let me know if you'd like to add something to this. I think it's really crucial to talk, about the risks and be very transparent when talking to patients or people to be vaccinated. But again, I think it's also as important to talk about the risks related to the actual disease, and those are higher. So here you really have bargaining power, so to speak. And I think it's important to be very transparent in this conversation, but at the same time to really try to focus and highlight the risks that are connected or associated with the actual disease.
Yes, exactly. We have been saying during this presentation the importance of transparency, of bi-directional dialogue, but also recognizing the actual facts and the relative risks that are very differential between the small risk of the ESAVI and the huge risk related with the disease that the vaccine is going to be preventing. So yes, that was very important, a very good question. So maybe because of the time, we can pass now with the exercise. Yes. Well, we're going to be making a small exercise just like the one that Katarina explained you before. This is a case study based on this that we were talking about, the dialogue with the vaccine hesitancy colleague. So this is the scenario that we are going to be presenting you. First, during a meeting of the health team, one of your colleagues tells you that he feels deep mistrust in the COVID-19 vaccine. And the description of this case study is that in the afternoon, a patient tells you that he has decided not to get vaccinated despite being in the high risk group, following the recommendation of a health professional. And related to the response mechanism of this exercise, you belong to the health team of a primary health center. So we're talking about infodemic in the work-related place. This is going to be a second slide now with a little more information about this case, a little more context. So the next days in the case, the report is that during this day, your colleague tells you that he has read an article that criticizes COVID-19 vaccines and that he has reviewed various social media posts that support his belief. And related to social media, you know that several professionals from this center have shared the videos and messages on their social networks criticizing the vaccine against COVID-19. And related to the impact, the information is received with concern. You believe that the health professionals are not handling the infodemic correctly. So now let's answer some questions together. Fernando, if you can launch the second poll. I'm not sure if you are seeing them.
We're not seeing them. Fernando, could you put the poll questions up, please?
I'm not sure that Fernando is listening to us. Maybe he's had some audio problems.
Maybe Maria Paz, while we're waiting for Fernando to put up the poll.
Oh, there it is.
Go ahead.
We were scaring him. Well, the first of one of the questions was, what should you say to your colleague who has expressed hesitancy to vaccines against COVID-19? And the options are, you must immediately censor their opinion. You should not communicate with people that are hesitant. The second option is share current evidence on the safety and effectiveness of COVID-19 vaccines. The third one is talk about the benefits, collective rights, and duties on vaccinations. And the last one, recognize the minimal risk of adverse events and differentiate the highest risk from vaccine preventable diseases. You can answer all of the ones that you think are the correct ones. And I'm going to be reading the second question. What sources of information would you recommend to your colleague? The first one, they should avoid social media, as information presented there is useless and dangerous. The second one, recommend to critically read all the information they received. And the third one, always confirm the information from official and reliable sources, like the PAHO or the World Health Organization, the Ministries of Health, the CDC, or the VSN. We're going to be waiting a couple of minutes for give you times for the answer. Fernando, if you can tell us where we reach. Okay. Okay, so the first one we were saying, it is very violent, right? A very difficult thing to say to another person that you work on, that you should censor it. And we will say in this couple of presentations that this is just the thing that we don't have to do because we want to embroad in a dialogue with that person. The hesitance does not mean that the dialogue is over. Maybe it's meaning that it's just starting. So that's very important. We are very happy that none of you answered that option. Then the next one of the options are very much in line that what we were thinking that was the right options. I'm going to let Katarina, if you want to do the analysis on the second answer.
Thank you so much, Maria Paz. Yeah, it's interesting that 6% of you said that, people should avoid social media. I think social media is a very, very tricky one, but I think we have to accept the fact that social media is all around us and we need to also engage on social media because a large proportion actually of our population gets a lot of the information on social media. So I think rather than saying, let's just not involve ourselves in social media, is to look at how can we actually develop effective strategies to speak with one voice and to actually also engage and interact on social media. And I think as we just have 12 minutes left, it's my pleasure to hand over to Dr. Pastor, who will give us an overview of some of the additional tools available from PAHO. The floor is yours.
Yeah, thank you so much, Catherine, and also Maria Paz for your excellent presentations. So I am Desiree Pastor. I am the Regional Immunization Advisor. I am the focal point for vaccine safety in the immunization unit in Washington. And I think that in the context of the introduction of the new COVID-19 vaccines, is very important to talk about the vaccine safety component. So I am going to tell you what PAHO is doing to strengthen the surveillance of the ESAVI, as we call in Spanish, is the events supposedly attributed to vaccination and immunization. And this could be associated falsely or correctly to the vaccines. So the next one, please. So PAHO has been working through a group of more than 50 experts in the last 6 months, I can tell, and with the purpose to create a regional surveillance system for the ESAVIs. And as you can see here, the purpose is to develop a regional ESAVI surveillance that is sensitive, which means that all the AFI, the serious ESAVI or AFIs, could be detected by PAHO. It's timely because we will have information in a real time, standardized because we want to have a common language, technical guidelines that will be with using the same terminology in all the countries across the Americas, trusty and integrated because we need to be confident about the information that we are receiving and know that the national ESAVI or committee, AFI committee has been review all the information and all the ESAVI that has been sent to us has been adequately classified as associated or not with the COVID-19 vaccines. So the general objective is to contribute to the timely detection of an appropriate classification on serious ESAVIs and risk signals for the generation of a fast and appropriate response at the national and also at the regional level. The next one, please. So, of course, we are very interested, as my colleagues have already said, maintaining a high degree of trust based on constant feedback on the safety COVID-19 vaccines, and we have created some tools according with the 5 strategies that PAHO has already identified and that have been supported with these experts in different topics. For instance, the first one is the risk management plans and a map and dashboards about the single COVID-19 vaccine that have been in clinical essays and also that are in the post-marketing phase. And the second one is to have a manuals, investigation and analysis tools that primarily we are going to use the global manual for the COVID-19 vaccine surveillance and also the PAHO regional manual that has been adapted from WHO in the previous years. First one is to create online courses. We are going also to conduct sub-regional workshops to strengthen the national capacity on ESAVI surveillance and also to create a website where we are going to upload all the new materials that are going to be accessible for all the population and also for the ministers of health. The fourth one is to have an active surveillance in place, because if we have a sentinel surveillance hospitals that could conduct special studies to know and to try to touch deeply in the relation about the ESAVI and the vaccine, this will be better. And also to be aimed to healthcare workers, older adults, and maybe pregnant women that have been vaccinated inadvertently with a new COVID-19 vaccine that has not been authorized for using in the pregnancy. And finally, and not less important, is to have tools for the social communication strategy, as we have discussed during all this webinar. So it's very important that Maria Paz, also Lauren and Katarina has been talked previously about these tools regarding the social communication in crisis, but also for preparing the response from the healthcare workers. Next one, please. The next one. So I am presenting here the COVID-19 vaccine, the Global Safety Surveillance Manual. As you can see, this is a manual with different colors. So the main purpose is to have different chapters, and because the target audience will be not just the government authorities, but also pharmacovigilance centers, manufacturers of vaccines, and of course, the national immunization programs and the regulatory authorities that will be doing the pharmacovigilance of AFIs or ESAVIs. And there's a chapter, there's a module that you can see here in color brown that is specifically dedicated for the safety communication in terms of how to conduct plans for social communication as well. Next one, please. So we also have a talk about the crisis communication related to vaccine safety. So PAHO has created this technical guidance. You can access to them in this link that I think that has been sent by the chat. And also, as I told you before, we are going to use the regional PAHO manual guidelines for guiding the risk communication plans at the country level. And in this PAHO regional manual, there's another chapter dedicated to the risk communication activities or strategy as well. The next one, please. So PAHO has created many COVID-19 publications where you can have a lot of information related with myth and rumors. This is very important. Another is the facts that the healthcare workers need to know. So these kind of talking points. also guidelines to create the risk communication strategy. As you can see here, this is another publication that we have created. It's very important and is written in Spanish and English as well. And many other guidelines as you can see here, many documents that are also uploaded in the microsite of the immunization unit at PAHO website as well. So the next one, please. So thank you. I think that we almost have covered many topics regarding the vaccine safety, and I invite all my colleagues here and my boss, Dr. Ruiz, to say the final words about this webinar. Thank you to all of you.
No, thank you, Desiree, for your last presentation, and thank you, Maria Paz and Katrina, Sofia, for your presentation, and obviously for Lauren and Mighty and all the team for the organization of this important webinar for this. But the most important book here is that you, the colleagues and the principal in the Caribbean countries, take these guidelines, take these tools, and put in place. Use them, please. If you have any question, you have additional comments, if you need additional support, please ask us. We are ready to help you. In the Caribbean, the role of the focal points, like Karen Karen Broom, that is our focal point for immunization, is ready to help you. But if you would like to communicate directly with us, we are open. The people who have the responsibility of this in our team is Lauren Bulanovic and Maite Vera. No, like this, but obviously Katarina, Sofia, and Maria Paz, like advisors, they are working with this. And Desiree Pastor, as you know, has the responsibility of the work of all the regional system for the epidemiological surveillance of IFE and all related with the COVID vaccine now. It's important that you put this in place. It's important that you share this information with all the health workers in your country. If you need support for the training, for the dissemination of this information, please ask us. It's the moment, not only for COVID-19, it's for the immunization program. It's really important, the immunization program. If people reject to receive the COVID vaccine, the risk that this family reject measles, polio, or HPV, etc., is higher. It's important to give the information. It's important to show the evidence. It's important that the people feel safe with the information that they have. Thank you a lot. Thank you for your attention. Thank you for your participation, and enjoy the rest of the day. Bye. Congratulations.